Hi, I'm James Garcia. I am the interim president for Somos Boricuaz here in Arizona. We are a community-based organization that is working to promote the culture and knowledge of the Puerto Rican community here in Arizona. And really also to, as we go along, we're a relatively new organization, an organization that is trying to develop community programs now that we are beginning to get past COVID. And let's cross our fingers that that is true, that we don't have another surge. But this is an organization that wants to be involved in a number of community activities. And one of the things we want to do, of course, is recognize people in the community for their achievements. So I'm here today because we have selected 4 people to receive awards this year for their community achievements and their professional achievements. And one of those people is Dr. Jenitza Serrano Feliciano. Dr. Serrano Feliciano was born in Arecibo in Puerto Rico. She is currently a chief medical officer in Pima County at the MHC Medical Center. She's been there since 2013. And MHC, by the way, has 17 clinics across Pima County. So she has quite a responsibility there. Before that, she was at the University of Texas Health Science Center in San Antonio, where she was an assistant clinical professor involved in training residents to become family physicians. And she studied at the Universidad Autónoma de Guadalajara in Guadalajara, Mexico, where she earned her medical degree. So thank you, Jenitza, for being with us today.
Thank you.
I just wanted to kind of, like I said, what we're doing primarily with these short videos is to let people know who the award winners are, where they're from, what they're about. And so let's talk a little bit first about this, the town that you were from. I understand it's on the northern coast of Puerto Rico. And from what I read, it was founded in something like the early 1600s. So it has a long history. Tell us a little bit about the town. That's, if you want to tell us about the history, that's fine too. But particularly, what kind of town was it? Where did you grow up?
So I grew up in Arecibo, and then it's La Villa del Capitán Correa. Mm-hmm. And it's one of the largest towns in Puerto Rico. If I don't remember wrong, it's like the 3rd largest.
Okay.
And it's a very cozy town, I would say, even though it's large. It has a lot of the rural areas, you know, more on the campo, and it's very cozy and it's very nice. It was fun to have the beach so close, and
it's
and
right on the beach. It is a beach town. It is right on the beach.
Yeah, it is. Yeah.
What was it like growing up there for you? What was it? I mean, what was it like? What were sort of the things that kept you occupied in Arecibo, aside from the beach?
You know, one of the things that I did most when I was growing up, it was actually just playing with my neighbors outside. So yeah. That was the funnest part, and what I cherish and remember so much. It was just those afternoons and endless days on the weekends, just playing outside, coming up with things to do, and inventing, using our imagination, you know, and just having that experience that, you know, unfortunately my kids don't have, haven't had.
Well, what took you?
That was one of the funnest parts.
What triggered, I mean, your interest ultimately in medicine? I mean, was it something early in your life, or is that something you came to appreciate later?
Well, you know, there was an elementary school very close to my house where my grandma used to take me. There was a nurse there. There was a little detached room with a nurse, and she would just give me maybe an injection of penicillin or whatever when I was sick. And I do remember the smell of the alcohol, like the environment of the healthcare smell. I really enjoyed it. I don't know why. But then also we always admire the doctors. I thought they were like, wow, they're so amazing. They know so much. They can help anyone. I want to be able to do that. And that's actually one of the reasons why I chose family medicine, so I could be able to help anyone at any age and any setting. And I'm very passionate about it. And I still remember those times. And
Was there anyone in your family? Was there anyone in your family who had been involved in medicine before?
No, I'm actually the first one. My mom was the first in my family to have a college degree. And she's an accountant, and I'm the first one in healthcare. Yes.
Yeah. So at least you had that experience of having a parent go to college, and were able to follow that. But it sounds like the folks that you saw and observed were somehow just role models to you, and you had an appreciation for what they were doing in the community.
Yes, for sure. They were an inspiration. Yes.
Yeah. So you studied there, your undergraduate degree, and then ultimately went to Mexico. Now, Guadalajara, Mexico, as I recall, is also on the beach, but is a very different city, very different community, of course. First, culturally, you were around Mexicanos, not so much Puerto Ricans, and it's probably a substantially larger city. What was your experience like going to Guadalajara?
Guadalajara was an amazing experience. Really getting to know a different culture, excuse me, and even a different language, because even though we're speaking Spanish, the words, and there are different words and different uses for different words, and it was fun to learn that. It is a huge city, so it was a great experience. You get to meet many other people, and in my class we were like 100 from Puerto Rico, so it was a great cultural experience for all of us and for all the Mexicans that met us. It was fun. We were the fun crowd.
Well, that's intriguing. So there were you had 100 fellow students. Is there a pipeline from Puerto Rico in terms of medical studies and degrees and Guadalajara? Is there like a long history of that?
Well, there's a group that is called the International Group, and it's for medical students from Puerto Rico and from the United States. They also have the Latino group. Not sure they still call it like that, but that's where all the other people from Mexico, Brazil, and other countries that will go and follow that path.
Yeah. Well, that's interesting because you went there and you weren't, first of all, the only Puerto Rican. So that probably helped. You had colleagues and friends who shared your cultural background, but also you got to meet people from all over the hemisphere, it sounds like.
Yes. It was really a very enriching experience for life, not only in my professional life, but actually in my personal life. It was growth. That's how I met my husband.
Oh, yes. So, you met your husband there, right? And he was originally from Sonora, is that correct?
That is correct. Yeah.
So after Guadalajara, where did you guys go? What was your trajectory after that?
After that, we went to Puerto Rico and we lived there for 3 years. So I took 1 year that I was just a wife. and then I started my path into residency, and then I transferred to San Antonio, Texas.
To San Antonio. Okay. So back in now in on the mainland, if you will, and in San Antonio, again, kind of another cultural shift, right? I mean, how was the adjustment to San Antonio? Because now you're not just part of Mexican American culture and quote unquote U.S. culture broadly, but also Texas culture, right? Texas, of course, thinks it's its own country, and so how was that for you in terms of your adjustment?
So it was not as big of an adjustment, I would say, since I already had some background knowledge on the Mexican culture, which is very prevalent in Texas as well as here in Arizona. And although it was not the same, it's really not the same, but it was an easier transition, I would say. And San Antonio is also a very big city with a lot culture and history. So it's a fun city to live. Yeah, Texans are something else. I mean, they're fun people. They're good people. They're just Texans. I don't know.
It's a unique breed. No, I've lived there for a number of years, so I know very well that culture, and have family actually right now in San Antonio. So I have some family there that I hope to go see soon.
I still have very good friends from there.
Yeah, well, that's great. And now you earned your residency there, but then you also taught there, and you were teaching. People to basically become family physicians. Did you enjoy the teaching world? Did you enjoy that?
Teaching, I love teaching. I'm very passionate about teaching. I think it not only gives back and helps others, grow in whatever area, but also keeps you updated, right? And you become a resource for so many people and different things. So teaching, I think it's a fantastic tool for growth for the receiver and whoever is giving. So yeah, teaching is one of my passions.
So what brought you to Arizona then after all of that experience? What took you from teaching something you love to being where you are right now?
So the main reason we moved to Arizona, it was because of family. So we ended up having 3 kids. 2 of them are twins.
Okay.
And we were in San Antonio with no close family, right? So we didn't have family any nearby, and it was always such a hassle to go visit anyone. So, or for them to visit us. So I am an only child, and all my family in Puerto Rico was kind of, growing older. So I wanted to have my kids to be able to have that experience of the cousins and the tias and all of that. So that's why we decided to move here to Arizona, to have at least my husband's family close by, since my younger cousins and all of that were already and some of in the States and some in other areas of Puerto Rico. So I thought that it was actually going to be a more enriched experience for them here.
And did you start here with the center in Serrano immediately in Pima County?
Yes, that's where I started. I started as a physician, and then 3 months later I took the position of medical director, and that position then transitioned into the chief medical officer like a couple of years later.
I see. And in that capacity now, you mentioned earlier that there are something like 17 clinics that are under that health center. Who is the community that you serve, and what is it sort of primarily known for, that center?
So MHC Healthcare is a federally qualified health center, meaning we have a mission to provide healthcare to those that are underserved. So we provide assistance for, let's say, low-cost healthcare. This is supported by some grants from the federal government that allow us to do that. So we try to go and locate ourselves in areas not only poor, right, but looking for a need of healthcare. So there are areas where in different areas in town that probably then the closest healthcare provider is at a significant distance, right? Okay. So we try to bridge that gap and fulfill that need.
Do you provide healthcare? You obviously deal with low-income communities and communities that may not have health facilities in immediate proximity. Does that include reservations? Is there reservation land in that area that you serve?
In that area, there is a small reservation close by. Yes, they do come to our clinic, although it's not an Indian
not
There's a
physically on
special
the
program
reservation.
there's a special program. We don't have that special program, but we do serve some of their patients. Yes.
And what are the services you provide? I mean, are these just sort of general medical family physician services? Is that
So
primary?
we provide family medicine, internal medicine, pediatrics, OBGYN, dental, behavioral health, the whole complete behavioral health services. We have pharmacies, WIC.
Yeah, the whole sort of broad panorama of it. It sounds like is in your role is your role specifically is it equivalent more or less to like a CEO at a large nonprofit? I mean, is that kind of your role in terms of the operations of it?
Well, no, there is a CEO.
Okay.
I am just below the CEO. I oversee everything that has any clinical aspect in the whole organization.
Okay.
So so it doesn't matter which department and which area, if it has a clinical sense or touch to it, I'm involved with that.
And what kind of staff do you have? I mean, what kind of how many people work for you basically?
Oh, that's a very good question. It's over directly under me. Directly under me, it's over 100 people. I don't know exactly the count. That's a
Yeah,
question.
these are these all doctors, a mix of doctors?
No, we have doctors, nurses, dentists, and then although there are other staff that do not report directly under my chain, if we're going to say it like that in terms of structure, I do oversee and determine different things like medical assistants and dental assistants and different staff. All the pharmacy also goes under my supervision. So even though they don't directly report in my chain, a lot of their job is guided by some of my decisions.
Right,
yes.
right. And what are the big challenges that you face with the population that you serve? Talk a little bit about that.
Well, a lot of the challenges is insurance coverage, right? So we provide a lot of services, and we have that grant, and we can support all of those primary care services within an umbrella. Unfortunately, when the patient needs a higher level of care, specialty care, maybe we did perform a screening mammogram, but that mammogram is abnormal and they need a surgeon or they need an oncologist. That is something that we cannot provide, and it is a big effort from our team to try to find resources. But that's one of the challenges sometimes that we have on serving our population.
Yeah.
The other challenges is like we're Latinos, right? We sometimes don't want to go to the doctor because when you go to the doctor, they find something.
Yeah.
And then so that's the challenge, because many times when they come in is because when they are actually feeling sick, and sometimes it's late to revert some of the damages that have been caused.
Yeah. So this
we also think I'm gonna eat this extra tostón, is not gonna do anything, right? But and then the extra tostón becomes the mofongo and the other mofongo, and then we lose track of the health changes.
Yeah.
So
yeah.
that compliance is a little.
But this is a population that it sounds like a lot of the folks that you serve don't have health insurance or have nominal health insurance. Yeah.
Yes.
Over the years, has the implementation of the Affordable Care Act made a difference in terms of the population that you serve? Are people signing up?
Yes, that made a huge difference. It did provided more people to be able to access healthcare. Yes, it did.
Mm-hmm. You've seen that in terms of your population. Do you still serve those folks when they're on the Affordable Care Act, or do they move to?
Yes, we do. We do. We take every insurance. Actually, we have a large private insurance patient population. Probably our largest population is the access population, but outside of that,
Access
we have
being the state.
the state Medicaid.
office. Yeah, yeah.
So yeah, so there's a lot of that. Medicare also, we have a good population of Medicare. Mhm.
What's it been like now for these last couple of years, or year and a half at least, through COVID? What has that been like for your centers and your clinics?
I'm gonna tell you, COVID has made me age like 10 years into.
Why is
It
that?
has been extremely stressful, especially I would say the first year when everything was so uncertain, right? We didn't know exactly what it was. We didn't know exactly how it infected others. We didn't know exactly what we needed to do to protect. So it was very stressful because you had to be making decisions, sometimes changing your decisions in the same day, right? Depending on the information that was being released. And it was very stressful to start making decisions. You change your whole operations on how you work, and then try to figure out, how do I keep my patients safe so they don't get exposed to COVID? But at the same time, cancer has not gone away. Diabetes has not gone away. Hypertension has not gone away. We need to see them and take care of them. So it was all those decisions of risk benefit of, oh my God, yes, I can push this visit, but for how long, right? And it's
and your staff would be at
challenging.
risk. Your staff would be at risk as well. I mean, you were facing the reality of before the vaccine, especially, but even now, certainly to a degree, right?
We still have a lot of safety measures in place, and to ensure that our staff is safe, because that's the other thing. We want to make sure that we don't expose, that anybody that comes in contact with MHC or our facilities is safe, right? And including the staff. And if we don't have the staff, we cannot serve either, right? So.
Yeah. What do you look forward to? And by that, I mean, what do you think will be coming, given that there perhaps have been a number of people who have postponed treatment for cancer screenings or other medical issues that don't have anything to do with COVID? Do you see kind of a wave of other issues that may come after COVID does finally pass?
Well, we have, actively been trying to outreach all those people that we haven't seen, and they are due for any of these preventative screenings, to try to get them in, or at least do the referral so they can go somewhere that is closer to them, whatever it is, because, especially, if you don't take care of those things, they will be later and more difficult to address.
Right. Are people responding? Are they responding? I mean, are they coming in the frequency that they should?
They are. I think we have been able to explain to them the importance and why is it important to come back and do that. One of the things that had us very worried for a long time was also the kids and their vaccinations, right? Yeah. And then we were able to maintain our vaccination rates during the pandemic, which was a great thing. But children are important to have checkups every so often to ensure that they're growing correctly, that there's nothing that it's out of place in their development. So that was also a challenge.
Yeah. Are you now heavily engaged in child vaccinations? Are your clinics a place where people are going to get vaccinated?
Yes, all of our clinics, we have vaccinations for children. We have that program where if you're uninsured or underinsured or under access, your vaccinations are covered.
Okay. And my last question about COVID, and I want to turn to something else, is have you had to deal with a lot of misinformation in the population that you serve about what COVID is.
Yes, it is. That has been another big challenge of COVID, is trying to be able to educate our patients and our staff regarding COVID and everything around it, regarding, how, the infectivity, the things that you can do, what you should do, what should you do to, protect others around you, to protect yourself. And the vaccine information about it has also been a big effort on education to provide that to the community and to our staff.
Yeah. So just turning quickly, and I won't keep you much longer, but just turning to your involvement, for instance, in Somos Boricuaz is, it's a community engagement thing. Obviously, I mean, it's an organization that is trying to engage in the community and assist the community. And how important is that to you, and or the other work that you do in your own community in Pima County, for instance, with regards to serving the public?
So Somos Boricuaz, I love the organization and its mission. I think it is a mission that an organization that wants to serve and wants to support, a minority, right? Even though we're a lot of Puerto Ricans here in Arizona, we're still a small group in comparison to others. And our mission is to support, well, not only Boricuas, but also other Hispanic and minorities in the state. And anything that exists that you can support, that the mission is try to support others, raise and do better, and be recognized for the efforts and hard work. It's worth participating in.
Yeah, and this is, of course, this is an organization that's very new in many ways, and had the unfortunate challenge of forming right before COVID.
Yes.
So it's by no means operating at full force yet. And what we hope is that once COVID passes and we're able to start to do activities in person, or reach out to the community more, that we can build it up, of course. But as you point out, the Puerto Rican population in the state of Arizona, which I think at last I checked was somewhere in the range of about 60,000 plus statewide, but it's probably growing because have you seen or noticed that more Puerto Ricans are coming to the community just in the years that you've been here? What's that been like for you in terms of the Puerto Rican community itself? Has it grown?
I think it has grown. And I think, more and more you hear it, or you hear, oh, my cousin just moved there, or so-and-so, can I get them in touch with you so they can get acclimated? And you see more food trucks.
Yeah. Yeah.
That is always a good sign, right?
Yeah.
So
No, that's right.
makes me very happy.
So you think the community is growing? Is there? Do you have a sense at all? Because I don't know how much you get back to the island, but since you may still have family there, but is it is there awareness about Arizona back in Puerto Rico, and what do they know about the state?
I don't think there is a real awareness what Arizona is in Puerto Rico. I still think that, the vision when you mention Arizona is this desolated, empty desert that is very hot. Yeah. So I think that's,
You find yourself having
real
to
benefit is not there. Yeah.
you find yourself having to educate people? I mean, when you go back?
Oh, yeah. And they get surprised to mention that, and 40 minutes from my house, I can go to the snow here at Mount Lemmon, right?
Oh, right.
Or a couple of hours you're in Flagstaff, which is a whole different, environment. So yeah, they're like, oh, wow, really? And then sometimes I put pictures of different of these places and, oh my God, is that in Arizona?
Well,
Yeah.
it sounds like you have to explain to people here what Puerto Rico is really like, and for instance, the fact that it's part of the United States of America, and vice versa, that you're having to explain to people in Puerto Rico what Arizona is like. So you're kind of in an interesting place.
Yeah, it's fun. It's fun educating. I mean, I love teaching, like I mentioned, right? So it's fun. And I still get the question is, do you need a passport to go to Puerto Rico, right?
Yeah,
So
right.
you know, so it's an opportunity to teach them.
And by the way, for people who are not from Puerto Rico or don't know, you don't need a passport to go back and forth to Puerto Rico. And Puerto Ricans are all
Yeah.
American citizens and so forth. The only thing Puerto Ricans don't get to do is vote in the presidential elections every go around, right? So, well, I want to thank you so much for taking the time out of your busy day. Congratulations on being recognized with the Somos Boricuaz Award this year. And good luck in everything that you're doing there professionally and in the community. And thank you for your time.
Thank you so much for this opportunity. I'm very honored.
All right. Have a great day.
You too.